Everybody, you are on the Dr. Y channel, and I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. So we continue our topics, and today's question is all about gout or podagra. Actually, it's a podagra. It's a name of the pain during gout. Okay, if you find a question like this, what is gout? Gout. What is gout? Gout is a disorder caused by hyperuricemia that results in the precipitation of monosodium urate crystals in and around joints, most often causing recurrent, acute, or chronic arthritis. The initial attack, so-called flare, of gout is usually monoarticular and often involves the first metatarsobophalangeal joint. Symptoms of gout include acute severe pain, tenderness, warmth, redness, and swelling. Definite diagnosis requires identification of crystals in synovial fluid. Treatment of acute flares is with anti-inflammatory drugs. The frequency of flares can be reduced by regular use of NSAIDs, colchicine, or both, just persistent lowering of the serum urate level below its saturation level with allopurinol, febuxostat, or uricosuric drugs such as probenecid. So it's largely sufficient like this when you talk about, if you find a question like this. Actually, hyperuricemia, when we talk about hyperuricemia, it's a serum urate more than 6.8 milligram deciliter or 0.4 millimole liter. So, and saturation level of serum urate is below, of course, 0.4. Okay, so just in few like this, maybe you can add that gout is more common among men than women. Usually develops during middle age in men and after menopause in women. Gout is rare in younger people, but it's often more severe in people who develop the disorder before age 30. Gout often runs in families. Patients with metabolic syndrome are in increased risk of gout. Actually, gout enters in the now we talk about metabolic syndrome, and gout is a part of metabolic syndrome. So okay. If it's you, if it's me, you and me, in the last day of your exams, it's okay. But I see that there is a continuum of questions about gout, so we have to answer. Actually, podagra, very few people know about that. Podagra, it's a name of the pain in gout. So what's next? Gout etiology and pathogenesis. No, etiopathophysiciology. So gout is a form of inflammatory arthritis that is caused by the accumulation of uric acid crystals in joints. The etiology and pathogenesis of gout involve complex interactions between genetic, environmental, and metabolic factors. For example, when we talk about genetic factors, genetic predisposition plays a role in the development of gout. Some people have a genetic tendency to produce or excrete higher levels of uric acid, which can increase their risk of developing gout. Certain genetic mutations can impair the function of proteins involved in the regulation of uric acid metabolism, leading to elevated uric acid levels and increased risk of gout. Dietary factors. Dietary can also contribute to the development of gout. Foods that are high in purines, such as red meat, seafood, organ meats, and certain alcohol beverages, can increase the production of uric acid in the body. High fructose corn syrup, a common sweetener in many processed foods and beverages, has also been associated with increased risk of gout, and it can raise uric acid levels. But actually this is out of the topic. So dietary factors is a question of eliminating uric acid components. Metabolic, this is a question of hydration. dehydration, hydration. Metabolic factors, metabolic conditions such as obesity, high blood pressure, insulin resistance, and dyslipidemia, abnormal blood levels, can increase the risk of developing gout. These conditions can disrupt the normal metabolism of uric acid, leading to its accumulation in joints. Renal factors. The kidneys play a crucial role in regulating uric acid levels in the body. Impaired kidney function, such as a chronic kidney disease, can reduce the excretion of uric acid, leading to this accumulation in the bloodstream and an increasing risk of gout. Inflammation. Inflammation is a key factor in the pathogenesis of gout. Uric acid crystals deposited in joints can trigger an immune response, leading to inflammation and the release of inflammatory cytokines. This inflammatory response causes the characteristic symptoms of gout, such as pain, redness, swelling, and tenderness of the affected joint. Not a joint. Acute attacks and chronic gout. Acute gout attacks are triggered by a sudden release of uric acid crystals from joints, leading to an acute inflammatory response. Over time, repeated acute attacks and the chronic deposition of uric acid crystals in joints can cause joint damage, deformities, and chronic gouty arthritis. So in summary, gout is a complex disease with multifactorial etiology and pathogenesis, involving a combination of genetic, environmental, metabolic, and inflammatory factors. So what's the next question? So clinic. So my friend, if you find questions like this, clinic once again means signs and symptoms, no clinical signs and symptoms of gout. So gout is a form of inflammatory arthritis and typically presents with sudden and severe symptoms. The signs and symptoms of gout can vary in variety and severity and may include joint pain. It's actually the first pain. So this is actually Podagra is a joint pain. Gout usually causes intense pain, often described as sharp, stabbing, and excruciating. The pain is most commonly experienced in the joint of the big toe, but it can also affect other joints such as the ankle, knee, foot, hand, wrist, or elbow. Inflammation though, so redness and swelling. The affected joint may become red, swollen, and warm to the touch. The swelling can be significant and may cause the joint to appear enlarged and deformed. Tenderness. The affected joint may be very tender to touch. The even light pressure of movement may cause severe pain. Even air can provoke a pain. Current air. Limited range of motion. Due to pain and swelling, the range of motion of the affected joint may be reduced, making it difficult to move or use the joint normally. Skin changes. The skin over the affected joint may appear shiny and may feel tight or stretched. Acute attacks. Gout often presents as acute attacks, which typically occur suddenly and can last for several days to weeks. After an acute attack resolves, the joint may return to quite normal, but without proper management, gout attacks can recur and become chronic. Systemic symptoms. In some cases, gout may be associated with systemic symptoms such as fever, chills, and general feeling of malaise. So it's important to know that all joint pain and swelling are due to the gout, and other conditions can present with similar symptoms. Proper diagnostic of a gout, Podagra, requires a medical evaluation including a thorough medical history, physical examination, and often blood tests to measure uric acid levels. Imaging tests such as X-rays or ultrasound may also be used to visualize joint changes associated with gout. Now this is a actual diagnosis. I suppose there is a question about diagnosis. It's a different diagnosis and differential diagnosis. So diagnosis of gout typically involves a combination of clinical evaluation, medical history, physical examination, laboratory tests, and imaging studies. Medical history. No, of course, as all disease. So the doctor will take detailed medical history, including asking about the patient's symptoms, family history of gout, because we have genetic predisposition, right? Medical conditions, medications, and dietary habits. Physical examination. A physical examination will be performed to assess the affected joints for signs of inflammation such as redness, swelling, warmth, and tenderness. The range of motion of the joint may also be assessed. Laboratory tests. Blood tests may be conducted to measure the level of uric acid in the blood. However, it's important to note that the elevated uric acid levels alone do not confirm a diagnosis of gout, as some people with gout may have absolutely normal uric acid levels during an acute attack, and not all people with elevated uric acid levels develop gout. Other blood tests, such as complete blood count and inflammatory markers, may also be done to rule out other conditions. Joint fluid analysis. Aspiration of joint fluid from the affected joint may be done to look for the presence of uric acid and crystals under a microscope. The presence of uric acid crystals in joint fluid is a definitive diagnostic finding for gout. Imaging techniques. X-rays or ultrasound may be performed to visualize the affected joint for signs of joint damage or rule out other possible causes of joint pain and swelling, such as infection or osteoarthritis. Differential diagnosis of gout involves considering other conditions that may present with similar symptoms, such as septic arthritis. The name is septic. Infection of the joint causes similar symptoms as gout, including joint pain, swelling, redness, and worms. Joint fluid analysis is crucial in differentiating between septic arthritis and gout, as treatment approaches differ. Pseudogout, also known as calcium pyrophosphate deposition disease, CPPD, is another type of crystal-induced arthritis that can cause joint pain, swelling, and inflammation. Joint fluid analysis is necessary to identify calcium phosphate crystals in the joint fluid, which is characteristic of pseudogout. Rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune inflammatory condition that can affect multiple joints, including small joints of the hands and feet. Blood tests for rheumatoid factor and anticyclic citrullinated peptide (CCP) antibodies, along with clinical evaluation, can help difference rheumatoid arthritis from gout. Actually, the same thing. Yeah? No, I said never. I said nothing. Autoimmune disorders. Osteoarthritis. Osteoarthritis is a degenerative joint disease that can cause joint pain and swelling, especially in weight-bearing joints. X-rays and clinical evaluation can help differentiate osteoarthritis from gout. Other inflammatory arthropathies. Other inflammatory arthropathies such as reactive arthritis, psoriatic arthritis, lupus arthritis can also present with joint pain and swelling and may require further evaluation to differentiate from gout. So acute diagnosis of gout is important for appropriate, of course, management and treatment. Treatment, management, same thing. Treatment of gout. So the treatment of gout aims to manage acute attacks, lower uric acid levels to prevent future attacks, and prevent long-term joint damage. The treatment approach may involve lifestyle modification, must involve lifestyle modifications, medications, and management of underlying health conditions. The specific treatment plan for gout may vary depending on the severity of the condition, the frequency and severity of gout attacks, the presence of other health conditions, and individual patient factors. For example, lifestyle modifications, dietary changes, avoiding foods high in purines, such as red meat, organ meats, seafood, alcohol beverages can help reduce uric acid levels in the body. Increasing intake of low-fat dairy products, fruits, vegetables, and whole grains may also be beneficial. Actually questionable, but anyway, you answer in this manner. Weight management. Maintaining a healthy weight can help reduce the risk of gout attacks. And excess weight can increase uric acid levels in the body. Also questionable. Highly questionable. Hydrations. That is so this is a hallmark of management of gout. Hydration. Staying well hydrated by drinking plenty of water can help flush out excess uric acids from the body, potentially reducing the risk of gout attacks. This is the hallmark of all thing. So your benchmark is hydration. Limited alcohol intake. Limiting. Alcohol can increase uric acid production and decrease its exertion. Maybe. So limiting or avoiding alcohol consumptions, particularly beer and spirits, can be beneficial in managing gout. Medications, non-steroid or anti-inflammatory drugs, NSAIDs. NSAIDs, for example, if they asked you, such as ibuprofen, naproxen, indomethacin, are commonly used to relieve pain and reduce inflammation during acute gout attacks. Colchicine is an anti-inflammatory medication that can be used to treat acute gout attacks, especially in patients who cannot tolerate NSAIDs or have contraindications to their use. Corticosteroids, such as prednisone, may be used to reduce inflammation during acute gout attacks, either orally or as an intra-articular injection into the affected joint. Uric acid lowering medications such as allopurinol, febuxostat, febuxostat or probenecid may be prescribed to lower uric acid levels in the body and prevent future gout attacks. These medications work by either reducing reducing uric acid production or increasing uric acid excretion. Management of underlying health conditions. If gout associated with other health conditions such as hypertension, hyperlipidemia, diabetes, kidney disease, managing these conditions appropriately may help in the management of gout. Okay, so also hypertension, hyperlipidemia, diabetes, kidney disease, hypercholesterolemia, diabetes mellitus, etc., obesity, all of them as gout is a part of metabolic syndrome. Remember that. So actually this is the same disease. That is, all of them is the links of the same chain. Lifestyle and dietary recommendations. Regular exercise, regular physical activity can help maintain a healthy weight, healthy weight, actually not a question of healthy weight, it's improve joint function such as reduce the risk of gout attacks. Avoidance of trigger factors. Identifying and avoiding trigger factors may exacerbate gout attacks, such as certain foods, alcohol, and dehydrate can be helpful. So hydration. Long-term management. Concerning long-term management, maintenance of uric acid lowering medications once limited. Uric acid lowering medications are typically used long-term to prevent future gout attacks, and adherence to prescribed medication regimen is important. Hydration, remember. So gout prevention, last question I suppose. Yeah, gout can be prevented or managed through lifestyle modifications and medications interventions aimed at reducing uric acid levels in the body. Diet modifications, limiting purine-rich foods, avoiding or limiting intake of foods high in purines, such as red meat, organ meats, liver, kidneys, seafood, sardines, anchovies, mussels, and subtypes of vegetables. Spinach, asparagus, cauliflower can help reduce the production of uric acid in the body. So the problem is not the production of uric acid. The problem is of elimination of this from the body. Encouraging low-fat dairy products. Low-fat dairy products such as milk, yogurt, and cheese have been associated with lower risk of gout, as they may help to lower uric acid levels. Low-fat dairy products. Increasing intake of fruits and vegetables. Fruits and vegetables are generally low in purines and high in antioxidants, which may help to reduce inflammation and lower the risk of gout. Hydration. Limiting alcohol intake. Alcohol, particularly beer and spirits, can increase uric acid production and decrease this excretion. So limiting or avoiding alcohol consumption can be beneficial in preventing gout. Well, maintaining a healthy weight. Excess weight, especially obesity, is a risk factor for gout and can increase uric acid levels in the body. Maintaining a healthy weight through regular exercise and a balanced diet can help reduce the risk of gout. Why? Staying hydrated. Staying well hydrated by drinking plenty of water. Plenty of water can help flush out excess uric acid from the body, potentially reducing the risk of gout attacks. Staying hydrated. Medication interventions, uric acid lowering medications such as allopurinol, fluvoxostat, and probenecid may be prescribed to lower uric acid levels in the body and prevent future gout attacks. These medications work by either reducing uric acid production or increasing acid excretion. Managing underlying health conditions such as hypertension, hyperlipidemia, diabetes, kidney disease, metabolic syndrome can help the prevention and management of gout, and as these conditions may contribute to higher uric acid levels in the body, actually lifestyle modifications act on every part, every chain of this continuum, every link of the chain. Lifestyle recommendations: regular exercise, regular physical activity can help maintain a healthy weight, improve joint function, and reduce the risk of gout attacks. Avoidance of triggers. Trigger factors. Identifying and avoiding trigger factors may exacerbate gout attacks, such as certain foods, alcohol, and dehydration can be helpful in preventing gout. So anyway, my friends, remember that you have to explain your patient staying hydrated. Water. No, of course, step by step, augmenting consumption of the water. So that's largely enough concerning gout. 25 minutes. Of course, no time for answering all this on the exams, because you have 3 questions. You answer 25 minutes, 30 minutes on each question. You will not be finished this year. This group, of course, this course. So thanks for your attention, my friends. Stay in touch. So subscribe and follow the channel. God bless you, and see you in another lectures. Bye-bye.